Hello, everyone. Welcome to another review class for our practitioners from the Philippines. So today we shall be discussing bladder patterns. Okay. Bladder or urinary bladder. These patterns are vital in traditional medicine. It reflects the interplay between the bladder's functions and the body's overall health. So these patterns will help diagnose various urinary issues and emotional conditions, providing insights into underlying imbalances. Okay. What are the functions of the bladder? Number one, it removes water by G transformation, okay, to ensure balance and proper hydration levels. So if your bladder is not okay, then you cannot eliminate the water. And the bladder serves as a storage facility for urine, accumulating it until ready to be expelled. This function is essential for maintaining urinary control and proper bodily function. Some patients, especially the elderly, they use diapers because they cannot seem to control their urine. In addition to storage, the bladder regulates elimination of urine from the body, facilitating the release of waste fluids at appropriate times, which is vital for detoxification. So, what are the general symptoms of bladder patterns? So, there will be discomfort, pain during urination. So, your urination should be painless, no? Difficulties in starting or maintaining urination. There are some people, they find it very difficult to start urinating. In fact, I remember there was one in the public urinal. It would take to take 10 minutes for the elderly male to start urinating. Increased frequency, challenges in controlling urination. Okay, dampness in the lower burner can lead to turbid urine. So if your urine is turbid in color and then significant difficulty in urination, this will indicate that there is blockage in the bladder and associated symptoms. Sinking of the chi, okay? There is frequent urination and incontinence. This time you need diapers, no? So this suggests an underlying deficiency in energy that supports bladder function. Chronic cystitis, no? Characterized by urinary symptoms that may not be related to actual infection. This is often linked to sinking of qi. That's why it's very important to have acupuncture treatments for the elderly, diba, sister? And it is very, very important. Just don't ignore minor symptoms like this. See, even emotions, no? This will include dark thoughts characterized by jealousy and suspicion. If you live with somebody who's quite suspicious, so this tells us a lot about the bladder function. Now let's go to overview of bladder channel pathology. A prominent symptom is urination, urinary retention or retention of urine. Okay, this indicates underlying imbalances within the bladder channel. Malaria can also present with symptoms related to the bladder. So this highlights the interconnectedness of systems and how infections can influence urinary functions. There are associated symptoms like enuresis. You know what's enuresis? Bedwetting, manic and depressive disorders, and various pain sensations can indicate underlying issues in the bladder channel. So this underlines the importance of holistic assessment of your patient. Now let's talk about empty bladder patterns or deficient bladder patterns. We have bladder deficiency and cold. Of course, the urination is frequent and pale but abundant. Incontinence and enuresis. So that means the bladder is very weak. It cannot store the urine, no? Lower back ache and dizziness, feeling of cold and white discharge. So if we have weak, we also have excess or full bladder patterns. There are only two, damp heat and damp cold in the bladder. So let's start with bladder deficiency and cold, bladder that is quite weak. Frequent pale and abundant urination, indicating a deficiency in bladder function and coldness. Incontinence and enuresis will reflect the inability of the bladder to hold urine. So this is linked to deficiency and cold. Lower back ache and dizziness. It indicates possible kidney involvement. Remember, the kidney and the bladder, they are a pair, no? Nocturia, nighttime urination, is common in bladder deficiency, disrupting sleep and indicating the need. So if you keep on urinating during the night, because normally you should not pee too much, too often at night. You should only pee like once, no? A pale and wet tongue accompanied by deep weak pulse indicates deficiency cold condition in the bladder. Okay. So what are the causes of bladder deficiency? Excessive sexual activity, because this can deplete kidney yang. So if you have a very weak kidney yang, you have a very weak bladder. Okay. So there will be frequent urination and incontinence. So maybe the patient has multiple sexual partners in the past, no? Exposure to cold and damp environments can particularly affect women, especially during menstruation, because during menstruation, they are susceptible to invasion of cold. Excessive exercise will lead to fatigue and strain, and this will weaken the body's overall energy, including your kidney yang. So if you have weak kidney yang, you will have a very weak bladder. Treatment principles of bladder deficiency and cold. Of course, this is weak, so you have to tonify and warm both the bladder and kidney yang. This helps restore the balance of qi and heat in the urinary system. Okay? So what are the acupuncture points? Okay, I'm sure you're familiar with bladder 23 and do 4. They belong to the same level. They're found on the same level. You have to do moxibustion here, a favorite procedure of Sister Rosa. Okay, maybe you should try doing moxa on all patients with the bladder deficiency and cold. This is used to tonify the kidney yang and strengthen the bladder. Remember, if you have good kidney yang, it will improve the bladder function. Okay, very easy. Another point would be bladder 28, which is the back shoe point of the bladder. Okay, to enhance bladder function and to address urinary disorders. Tract 4 or CV4 to strengthen the qi and yang. You also should do moxa here to enhance overall vitality. Run 3. Run 3 is the front moo or the alarm point of the bladder. This is crucial for regulating bladder function and supporting urinary health. So we have or 6, no? Run 6 helps to tonify the qi in the lower burner to promote better energy flow and supporting bladder function. Do 20 to tonify and lift the qi. Remember, we need to have a good bladder qi, kidney qi, no? Because do 20 can tonify and lift the qi. This is very effective in cases of bedwetting or enuresis and incontinence. So if you happen to have somebody at home, or if you have a relative who is using diaper, this could help, no? Okay. So now let's go to damp heat in the bladder. What are the key symptoms? Burning sensations during urination, dark urine, difficulties in urination, and they stop mid-flow. Imagine they stop peeing at the middle, no? This indicates an acute condition affecting the urinary system. So there is frequent and urgent urination, dribbling at the end of urination. Okay? Turbid urine, blood in urine, formation of stones. So remember, damp heat is stones. The patients may experience lower back pain or lumbago, fever, thirst without the desire to drink, because if you have damp heat, you feel thirsty, but you don't want to drink because of the dampness. Sense of fullness and pain in the lower abdomen, along with the general feeling of heat. So when you look at the tongue, remember there is damp heat. The coating is sticky and yellow at the root because the root is where the bladder is, no? With red spots. So that's damp heat. The pulse is typically slippery and rapid. Damp heat. This can be crucial for the diagnosis of damp heat conditions in the bladder. What causes damp heat in the bladder? Chronic exposure to damp and cold can lead to accumulation of dampness in the bladder. And we all know for a fact that dampness doesn't stay in forever. It will become damp heat after a period of time, no? So dampness becomes damp heat over time. So this is very common in individuals who frequently sit on damp surfaces, like in the beach, no, or the pool, or they live in humid conditions. Emotional stress, like prolonged suspicion, jealousy, or anxiety, can contribute to damp heat in the bladder. So these emotions initially will lead to chi stagnation. So when you have chi stagnation, there will be this will affect your urinary function, promoting damp accumulation. Treatment principles. Of course, you have to resolve the dampness and clear the heat. This treatment approach also includes opening the water passages of the lower burner to ensure proper urinary function and alleviate discomfort. Okay. So what are the points? Uh, these are the points. First, we have round 3, front move of the bladder to help regulate bladder function and resolve dampness in the lower burner. I think everybody knows where this is, no? 5 soon below the navel. Another point for damp heat is bladder 66. This is a yin spring point, remember? Uh, it helps clear heat and dampness so that you can facilitate urination. Of course, our favorite, spleen 6 and spleen 9 for dampness. Okay. Bladder 22 is the Santiao Bakshu point. We need the Santiao to transfer the water in the lower burner so that you can help open the water passages. Bladder 28, remember the Bakshu of the bladder, to clear bladder heat and to resolve urinary issue. This one, I think everyone is familiar with this now, the she cleft point. Bladder 63, remember? Okay, this is an accumulation point or a she cleft point, crucial for stopping acute pain during urination and addressing urinary issues effectively. Then we have a stomach 28, the fluid transformation point, to promote the transformation of fluids in the lower burner, contribute significantly to resolving dampness. Okay, we're done with damp heat. Let's now go to damp cold. In damp cold of the urinary bladder, the primary symptom is difficulty in urination. And this indicates obstruction in the passage of urine because cold is very it contracts, diba? So you'll have difficulty, no? Feeling of heaviness, that's because of the dampness, okay? Both in the bladder and hypogastrium. This is attributed to accumulation of dampness. If you look at the color of the urine, it's pale and turbid. So damp, cold. Okay? Frequent and urgent urination. This is the result of the bladder's inability to effectively store and expel urine due to the obstructive nature of damp cold. Then look at the tongue. Uh, you will see a white sticky coat because it's cold, damp cold, indicating the presence of dampness. So when you feel the pulse, it's going to be slippery and slow because it's cold. And then slightly wiry on the left position, reflecting the cold and damp condition. So left, sir, is kidney, right? Bladder. Causes of damp cold. Spleen chi deficiency, because this leads to weakened ability to transform and transport fluids. So your body is more susceptible to dampness and cold accumulation in the bladder. Excessive exposure to damp and cold. Okay? Living in damp environments or sitting on cold surfaces. So avoid sitting on cold surfaces. This will lead to accumulation of dampness in the bladder. Okay? Kidney yang deficiency. This weakens the body's overall yang energy. Remember, the kidney is the root of the yin and yang, no? And it makes it difficult for the body to warm and transform fluids, thereby contributing to the development of damp cold in the bladder. Treatment principles, of course, you have to focus on resolving dampness, expelling the cold, and remove obstruction in the water passages of the lower burner. And we should address the root causes and alleviate symptoms. Now, I'm sure you're more interested in the points. Same points, RAN 3, because it is the front main of the bladder for regulating bladder function and resolving dampness in the lower burner. Okay. What happened to this? Next, we go to stomach 28. Familiar? To stimulate transformation of fluids and enhances water metabolism in the lower burner, addressing dampness effectively. And then we have spleen 6 and spleen 9, our favorite points for dampness. Okay, we're also familiar with bladder 22, the Bakshu point of Santiao, to help open the water passages, facilitating fluid transformation in the bladder. Bladder 28, the Bakshu bladder point, to tonify, excuse me, bladder function. This is very important, especially for the elderly, so that we do not see ourselves using diapers. Okay. Run 9 is called the general dampness point, to address general dampness in the body, enhancing the treatment of urinary issues related to damp cold. Now, let's discuss interstitial cystitis. This is also common. It is a chronic condition characterized by bladder pressure, pain, and urinary frequency. This is actually what we call UTI, no? It significantly affects the quality of life, leading to emotional distress and limitations in daily activities. So we all know for a fact that the urinary bladder transforms and excretes fluids through the power of chi. So where does the chi come from? The kidney, right? Because the bladder is controlled by the kidney chi. So this essential process ensures the optimal balance of body fluids and the efficient elimination of waste. The source for bladder transformation. The urinary bladder relies on the kidney for its chi transformation function. So there is interconnectedness of the kidney and the bladder. So if you have kidney yang deficiency, you feel cold all the time, this will lead to deficiency in the bladder. So this will affect the ability to effectively manage fluid excretion. Okay. So what are the common pathological factors in bladder patterns? So the predominant pathological factor is dampness. So where does this come from? Climate, emotional stress can also cause dampness, and lifestyle choices. Okay? So this is something that everyone should be aware of because we will all grow old someday, di ba? So what is the general etiology for bladder patterns? And why is it very important to treat everyone um, for bladder issues, no? Excessive exposure to cold and damp weather can lead to accumulation of dampness in the bladder. So you will have conditions like damp cold or damp heat. Emotions like fear, anxiety, suspicion, and try prayer. No. Di ba, Sister Rosa? This can help relieve your anxiety. I cannot understand why some people will always have emotional issues when it's so easy for them to just pray, no? Children may experience nocturnal enuresis due to fears, while adults may develop urinary issues linked to long-term battled emotions. Because we are all civilized, sometimes you cannot express our true emotion.
Because the emotion can block your meridians.
Yes, yes, sister.
Pressure affected the stomach meridian. Some people after get angry, they could not eat.
True.
Yeah, it's block meridians.
So if it blocks your stomach meridian, your spleen, where can you get the energy from? Diba?
Yes, yes.
Very good. And the energy you need it also for the kidney. That's why let's take care of the elderly. No? Even if they're not, some of them will just ignore this, like, oh, it's part of growing old, but no. This can lead to a lot of things, no? Especially if the patient had the history of excess sexual activity. Too much sex can deplete the kidney yang, and so this will affect the bladder. Okay? So this depletion, okay, we're all adults here. I had a patient before. He was like in his early 60s. He just retired from the military, and his complaint was he can no longer keep it up. So I started asking, like, how often do you do it when you were younger? Remember, he's a soldier. He said he does it 15 times a week. I said, oh my God. So what happens to your wife? And he said he had to be honest with me. Of course, he just doesn't do it with the wife alone. There are many partners. So payback time. So now she is having issues with the bladder. So this can, if you have weak kidney yang because of too much sex, this will affect your bladder. So there will be frequent urination, nocturia, you always pee in the night, or incontinence, highlighting the connection between sexual health and urinary patterns. Okay? And it's always good to pray because according to a friend who is very religious, just even the thought of doing it can actually, affect your mental health. Okay. So excessive exposure can weaken the chi of the kidneys, cold and damp. Okay. So there will be stagnant energy in the bladder. Okay. Sitting on damp surfaces, chronic damp living conditions. No? Accumulation of dampness in the bladder, there's damp cold and damp heat. So this will impact the overall health. So I think we have tackled so much. Thank you so much for listening.